Good afternoon, everyone. Good morning for those of you on the West Coast. I'm Dick Seligman from the California Institute of Technology, and it's my pleasure today to moderate the session, The Impacts of COVID-19 on Research Activities, the University Perspective. A few words of introduction about today's program. We have a panel that includes two faculty members who are also principal investigators on federal research grants, and two senior research administrators. Rather than a series of presentations, we're going to have a discussion around a series of topics relating to the impact of COVID-19 on universities. The panelists and I have put together a list of questions and topics that we think will be of interest to you. We'll try to have time to address your questions. Please use the Q&A feature at the bottom of the Zoom screen. And for those questions which we don't have time to discuss during today's session, we will make our best efforts to answer them and post the questions and the answers online. Now I'd like to introduce the panelists. First, Alexandra Albanak, Associate Vice Provost for Research Administration at Johns Hopkins University. Neil Charnas, the William G. Chase Professor of Psychology and Director of the Institute for Successful Longevity in the Department of Psychology at Florida State University. Michelle Masucci, Vice President for Research at Temple University, also the Director of the Information Technology and Society Research Group, and a professor in the Department of Geography and Urban Studies. And Craig Reynolds, the Assistant Vice President for Research and Sponsored Projects at the University of Michigan. Welcome to all of you. So let's get started. I'd like to begin today's session by asking each of the panelists to offer a brief statement about the overall impact of COVID-19 on them and on the work that they have been doing. I could follow the time-honored tradition of asking for a volunteer. Who would like to begin?
I'll be happy to start out. Thank you, Dick. I'll start on the personal side and move to the professional. I think one of the things that well, first of all, just to explain, I've been under self-quarantine and then at home stay since about March 10th, after I came back from a conference, developed head cold, I believe, and unfortunately ended up after my 14-day quarantine with the city closing us down. So one of the first things I would say is it gave me rather solid experience and I guess additional empathy into the sorts of psychological disorders that my colleagues study, like general anxiety disorder, but also the issue of loneliness and social isolation. But let me shift to kind of the research dimension. I'm fortunate to have research support from National Institute on Aging. I've got involved in a PO1 there. I also have support from NIDLR, National Institute for Disability and Independent Living Rehabilitation Research. And generally, what I end up having to do is collect data from human subjects. And in my case, they're older adults who are at very high risk for COVID-19 if they contract it. I use a combination of survey and experimental, like tablet and computer studies. And even before FSU's IRB closed down face-to-face research, in conjunction with discussion in my lab, we closed down our contacts with older adults. And so we started planning fairly early how we can move our research to alternate methods. One of the things that we're engaged in is a cross-site randomized control trial. And ironically, the project concerns reducing social isolation and loneliness in older adults through the use of technology. And we've been struggling trying to understand how best to continue to collect data according to protocol for things like our 9-month and our 12-month appointments. which normally would be carried out in homes, but obviously can't be done that way. So we're reshuffling our lab activities, redesignating who are essential personnel who can have lab access during the phased reopenings that we're experiencing, how we shift our graduate students and postdocs to projects that can be done remotely. And then, I'll comment very briefly. As you mentioned, I direct the Institute for Successful Longevity. We have about 1.5 staff positions. And one of the things we were very concerned with is how we could continue effectively from home for things like our brown bags, our Sea Grant reviews and awards, our newsletters. Took a little bit of time. We have the advantage we're a virtual institute. And so that transition turned out to be relatively painless. But we're extremely grateful to all the terrific ICT we have today. Thank you, Microsoft Teams, SharePoint, OneDrive, and of course, Zoom, that we're all using intensively.
Thank you, Neil. Alex, how about you?
Oh, thanks, Dick. I would say, and I think most administrators are going to agree with me, that what's really changed is the work has accelerated. The pace, the complexity of what we've been doing has just gotten, it's nonstop. At first, I think everybody was energized, let's get this all done. But I think what does energize us at this point is the differences that we're seeing in the type of research that researchers across all sorts of different divisions have come together to solve problems, the COVID problems. So that's been really exciting. I think I've also seen staff across different offices, our general counsel, our school of medicine colleagues, getting together almost on a daily basis to work together on how to get these agreements out, how to support the faculty in their urgent COVID work, and how to enhance our communication and make sure everything is transparent and done very quickly. So it's been very exciting. I think most people would say somewhat exhausting, but all in all, it's been pretty inspiring seeing the faculty do what they're doing.
Thanks, Alex. Craig, how about Michigan?
Well, for myself, I'm just tired. I'm tired of Zoom. I'm tired of meetings back to back, 8 o'clock to 5 p.m. and then later. I'll second Alex's comment. The pace of the change and the volume of the change is just unprecedented. And I have diverted 95% of my attention away from my normal job to focus on COVID-19 in our institutional response. I was just thinking this morning, I have an upcoming meeting with my boss, the Vice President for Research, to go over my performance on my goals over the last year. I can't even remember what my goals were because everything's just been supplanted by the urgent. So it is inspiring to see the institution respond. I've had to grow as a professional and get outside of my own comfort zone. Research administration is all about finding solutions to problems. Well, we're now facing novel questions that have no precedent that we can look to, and so we're making it up as we go, with the best guidance that we have available to us, which is not a comfortable place to be. But overall, I'm grateful to still have a job. There are many people who aren't as lucky as we are to work in this profession. So challenging, but thankful.
Thanks, Craig. I'm glad you had time for one more Zoom meeting today. We're pleased to have you with us. So Michelle, how are things at Temple University for you?
Much the same. Like many of the people on the panel, I have 2 different roles at Temple University. I'm both the Vice President for Research and really responsible for leading the effort for the planning and logistics related to our university's ramp down and ramp up planning. And I'm also a principal investigator of both a federally funded project and a project that's funded by a foundation that's local here in Philadelphia. On the administrative side of my set of responsibilities, to say that there's been an increase in meetings, it's kind of the understatement of the decade. It's just a nonstop crush of meetings and follow-up activities that need to happen in order to align approaches across our very large public institution. We're 40,000 students, 10,000 employees with a health system. But because we're a public institution, we face, you know, different kinds of financial constraints that all institutions do. And so that alignment and efficiency and as well the equity consideration of how we go about what we're doing and how it affects different populations is incredibly important. And so I and my team of colleagues in the Office of Research are all deeply involved in dealing with all of that transition. It also means that we're dealing with stakeholders. So we've always dealt with lots of different stakeholders, but now the stakeholder conversation is just so much more complex. So in one conversation, it might be working with the Commonwealth to deal with providing PPEs by inventorying what we have available and making that available to a statewide clearinghouse. In another, it's dealing with local level government to make sure that we're aligning how we respond in terms of providing care to residents to meet the demands of the ebbs and flows of the actual virus itself, to ensuring that we have a track. We actually created a fast track for research projects related to COVID-19. So we also are doing what we can to support our colleagues to move as quickly as they possibly can to stand up new trials that would help provide some better understanding. And because we are in a location in Philadelphia where we have a large underrepresented population that's actually treated, we have the opportunity to provide some really important information related to this particular virus response based on that population. And then it goes all the way down to the nitty-gritty of dealing with the specific needs of specific individuals. I mean, I am the hotline call for every individual that wants to go back to their lab if they can't get in because their building is closed. And so we have a little mini protocol there where they try to get in, and if they don't get in, then they call me and I call campus police, and the campus police lets them in. So it's just an absurd range of detail that we're involved in order to get the job done. And then, oh, by the way, I'm a PI, and a lot of my research individually happens in the summer because I work with high school students from the school district of Philadelphia, which in and of itself is being dramatically impacted in terms of what our high schoolers are able to do in this setting. And it's just a sea of concern about the educations that they're receiving and the challenges that they're having for dealing with access to information. The digital disparities that exist in our communities are really very prevalent right now as everyone tries to get resources. And so my life is balancing all of that. So let's just say I live on Zoom.
Well, you know, at the very beginning of our stay in place situation, I heard on the news the mayor of Philadelphia was speaking, and he was talking about how grateful he is to Temple University for having made available a large facility. I don't remember what the facility was, but a large facility to be used for housing patients.
Well, thank you for noting that. The Leah Corus Center, it's right on Broad Street. And because they actually had National Guard support for that hospital facility, we actually closed Broad Street, which is not only the main artery going north and south right through the city, including right through City Hall, it's also a state highway. So just to imagine what it would have taken logistically to block off Broad Street over a number of blocks and make sure that people have access to that facility, it's a kind of modern feat of coordination.
Well, thanks to all of you for your initial comments on the impacts of COVID-19. So for the benefit of our participants out there in Zoom land today, we've grouped some topics around several headings. General questions about the impact of COVID-19, federal sponsors, financial issues, reopening issues, the role of the FDP, other research administration issues that might have been set aside or deferred, and then finally a series of concluding comments. And for each of the items within these sections, we have agreed in advance on the panelist who will be the initial responder, but the idea is that everybody will have an opportunity to jump in. So turning to general questions about the impact of COVID-19, Alex, what have been some of the biggest challenges for your university's research program relating to this situation?
Well, I think both at the ramp down and ramp up stages, what's first and foremost in everybody's mind is ensuring health and safety for the faculty, staff, and the students. Initially, when we decided to ramp down the research, it was earlier than a lot of our other institutions, and I think that the conversations were about worrying about the students, making sure that they could get home if they needed to get home, making sure they didn't feel compelled to show up at work even if they felt uncomfortable. And that also was for the staff. Our provost specifically said, we need to start, we're going to need to just send people home and make sure that they can work remotely, because faculty are very enthusiastic and probably would continue to work on their research throughout the term, absent a government order, which we did subsequently get. But we wanted to make sure that everybody was safe and could, were healthy. Also, huge impact, particularly because we have a medical school, is that many people were diverted to the clinical setting. Their entire departments, general medicine, all working in the clinical, which obviously has a big impact on research, even if it could, proceed remotely. So the resource allocations of our faculty, the students were sent home. So I think that, nothing was allowed on, no research was permitted with the exception of critical research, which essentially was COVID-related research. So now we're working on ramping back up, and that, of course, is a huge challenge as well. We have a plan that was released last week in a draft form, and so PIs are currently working to prepare their plans and submit them to ensure the safety and of all the people that will be coming to the labs. And again, the labs will only be open to the extent that they need to be until we hit a different phase within Maryland, which we're getting ready to hit phase 2. But Hopkins is very concerned using our professionals. We have a great school of public health, #1 in the world, and we're being advised by them of when it really is safe to start to reopen.
Who else would like to comment?
Well, I'll jump in and share. I mean, one of the biggest challenges. So first of all, the definition of big has changed. What I thought was a big deal 3 months ago seems to be small potatoes these days. But Michigan it's an understatement to say we are highly decentralized. And this, the COVID-19 pandemic has forced us to become highly centralized, or at least much more so. And so getting 3 campuses, 19 schools and colleges all on the same page and following the same guidance from the central office has been certainly an endeavor in change management and effective communication. And I think I would be remiss if I didn't mention the fact that we have estimated budgetary losses anywhere between $400 million and $1 billion. And that is a significant challenge to the institution. It's an existential crisis, and we have to respond accordingly. So how we get through that is a leadership issue. I'm sure it's under active discussion, and we will, I'm sure, find out more in the coming weeks and months as the fall enrollment numbers start to firm up.
Thanks, Craig. Any other comments? If not, let's move on. Actually, Craig, you have the next one. What are some of the things that your university has done to assist investigators during the pandemic? What more could be done?
Sure. So we have tried to reduce as much red tape as we can for anything that is COVID-19 related. So if to put it kind of in the shorthand parlance, if it has COVID-19 in the title, it gets fast tracked. We have waived our deadline policy. We will give priority to any proposal or award or contract or non-disclosure agreement, you name it, clinical trial, if it has COVID-19 in the title. We have created a research index of COVID-19 projects across campus to help facilitate collaboration amongst investigators. We stood up a research compliance committee specific for COVID-19 projects to help prioritize those protocols for the IRB and Animal Care and Use Committee. And wherever possible, we have tried to empower the local units to make decisions as long as those decisions are consistent with the principles that we have communicated to the rest of campus. So that requires frequent and clear communication. We're controlling the messages as much as we can, and we're doing town halls. We're frequently, at least weekly, having conversations with our research associate deans, informing them about what's happening and what we need from them. And we put out an FAQ that gets visited several hundred times a day. It's the go-to resource for our campus for any questions. So what more could we do? It's hard to imagine, but I think if we had exceptionally deep pockets, we could have a more forward position on how do we backstop the graduate students and the postdocs who find themselves in difficult straits right now. But that would require more financial resources than we have. I'd be interested to hear what my colleagues think about what else they could be doing.
I can maybe jump in on that a little bit. One of the things I really appreciated that our Office of Research has kind of taken the initiative on is trying to secure PPE supplies, because we have a broad range of research, from medical research, animal research, and so on, all of which really requires a reliable stock, so to speak, of that, also for reagents and so on. So it was really good that they centralized that early, and researchers through the department chairs kind of knew where to go to get help. So I think that was really, I really give them kudos for that activity. The issue of trying to help graduate students and postdocs is a really tricky one. And I think everybody's kind of going about it in different ways. So it depends a lot on the research projects that they're engaged with. If you can move their research, in my case, for instance, to surveys, to review papers, to writing up existing studies and so on, then there's something for them to do, at least in the short term. Although if you're in the middle of collecting dissertation research and you can't bring in an older adult into the lab anymore, yeah, that's a serious problem. I don't think there's an easy solution to that one. But again, I'd be interested in hearing from Michelle, Alex about what approaches they may have taken.
And Neil, if I can just jump in, I think that's a great point about supply chain issues. That this needs to be coordinated across the institution. And one of my comments that I was thinking on this morning was, you can't ignore the small stuff. You want to, as much as you would like to. We're 2 weeks into our ramp up, and PPE turns out we did a pretty good job, but blue painter's tape to mask to put on the floor to socially distance people in the lab, we ran out. At least that's what I heard. So the rate limiting factor might not be what you always think it is going to be.
Good point.
Yeah, I couldn't agree with that comment more, Craig. The shape shifting that's going on is happening at a mind-boggling rate. So as soon as you solve for one problem, there's, you know, 3 new ones to appear based on that decision. And I think that whole envisioning of how option A results in the possibility of outcomes, you know, related to that versus option B, I think that sort of scenario assessment process has been vigorously tested in this environment. And so we're often finding that while we're using what we think are the best practices and the best understanding, we have to put that to the test in actual practice. And then that gives us new information to sort of calibrate what our approach is. We're doing some similar things to what have been described on the call. Most notably, at least from my office's standpoint, we meet weekly with the associate deans for research to make sure that we have our ear to the needs of the schools and colleges. We also have multiple campuses, and we have extreme variability in terms of the resources that our schools and colleges have to deal with their responses. And so in some schools and colleges, it's more of an impact on their educational mission because of the large number of students that they have and their primary role for providing instruction to undergraduates. In other schools and colleges, research may be more preeminent, not to say that there isn't important research and scholarship going on in every discipline, but it's being experienced in highly variable ways. And so developing a system that's equitable and that is efficacious and that factors feasibility, those are the challenges that we face as administrators.
Thanks, Michelle. Alex, any thought you'd like to add?
Just to add on, I think one of the things that our university did really well early on was put up a website that was at first research preparedness, quickly moved to research response, offering resources, including how to get access to specific data repositories. And then we also, our vice provost for research, worked with the president and created a research response program that was funded. It ended up, it was initially $3 million, it went up to $6 million, where it was an internally competitive program, and within a month, we already have some amazing research results. 250 scientists have received the funding, over 25 projects. As I mentioned earlier, very diverse and multidisciplinary. We have engineers working with MDs, and it's just really pretty amazing. But I think, yeah, PPE was one of the first things they did as well. So the central coordination has been really important.
Thanks, Alex. Neil, I'd like to turn to you to address the topic of what kinds of activities can investigators and research staff perform when they're required to work remotely. You alluded to that earlier, and many of us have large numbers of investigators and staff who are being forced, at least for now, to work remotely. What are some of the things that they can do?
Yeah, it really, I think, depends a lot on the type of research project. So, you know, I'll take my own example, my own lab. I'm basically an experimental cognitive psychologist who unfortunately, or maybe fortunately, works with an at-risk population, older adults or aging adults. So we can't interact in person with them yet. And I don't know when that's going to happen, probably pretty far out at this point. So what can you do in the interim? For things like the clinical trial I'm involved in, we're basically trying to do salvage work, find other ways to administer psychological tests or neuropsychological tests over the phone or online using, resources like Qualtrics. In this particular clinical trial, we have people actually using, or we've trained them to use tablets. So we were kind of investigating how you can get the material, some of the material onto the tablets, pushing it to them that way. As I mentioned before, for other types of research, I've got grad students and postdocs doing kind of literature reviews. We're at the ramp up stage for certain funded research, ramping down for others. They can write up completed studies. They can conduct analyses on data sets. All that can be done very well remotely. I Zoom regularly with my students and the postdocs instead of holding in-person lab meetings. In fact, this session is interfering with one of them, one of my lab meetings this week. But it's a very different story for some of my colleagues who run studies that really require non-movable equipment when they're measuring things like physiological or biological variables. Think of things like DEXA scans for bone density, or doing neuroimaging work using fMRI or EEG for tracking brain activity, or even work I was doing previously using driving simulators for transportation research. Those are things that just plain stop. And so the best you can have is an understanding federal agency that gives you the opportunity to extend your grant period somewhat. Although then you run into the issues around financing, because the finance costs are not disappearing, even though you can't, fortunately, they're allowing carry forward. The other thing we're doing, and it depends on the discipline, for instance, our psychology department of FSU is updating one of the site licenses to get access to portable versions of psychological experiments. There's a popular package known as ePrime. They've developed ePrime Go, which you can remotely or without too much difficulty install. If say a participant has a computer, they can install it and run your study remotely. So, and we're looking into open source programs, Open Sesame, LabJS, others, where students can actually carry out their research if they've got participants who can install the research programs on their machines. The other thing we can do is we can work online. So a lot of us do survey research, and there are web populations like Mechanical Turk. We have a large ISL participant registry, 2,700 seniors who signed up over the past 4 or 5 years to participate in aging research. And there's been a big rush, I noticed, because I administer that. I provide the permission to researchers to request samples. And the other thing we're doing, of course, is we can also continue to write grant applications. So, it really depends an awful lot on the type of research, whether you're really stopped in your tracks or whether you can be somewhat flexible and reallocate effort.
Thanks, Neil. Our session today is focused on the impact of COVID-19 on research. But Michelle, if we just step back for a minute and take a broader look at our institutions, what are some of the issues that you face in aligning the research aspect of the campus with other institutional activities? And, I hate to admit it, but there are things other than research that many of our institutions do, and they are certainly important. How do we make those alignments?
Thank you for the question, Dick. Most certainly, and we are reminded of that often when we meet as a leadership of the university together. At Temple University, the beginnings of impacts related to COVID-19 happened with our need to urgently close our Temple University Rome campus in February. I think it was February 29th that we sent out a notice to community that said all Temple University students at TU Rome are coming back to the States. And then we watched as Europe closed down all of the avenues for them to be able to return. And so just that one scenario, which predates the rest of our COVID-19 response, it wasn't until March 16th that our governor had a stay-at-home order for Pennsylvania. And so in between 2 weeks, we mobilized an enormous amount of resources to deal with the challenges that our students were having. And we found the ripple effect. Announcements went out, but deans didn't necessarily know that students that they had at Rome, were now returning to main campus. There wasn't good understanding at that moment in time. The information that became available to the public at large, and certainly to us as institutions, kind of grew almost exponentially over that 2-week period of time. But in the very first instance, we had to simply react to conditions in a different country that really weren't well known to us at the time. Of course, we now know how devastated Italy was, by their own COVID-19 issues. But that was our sort of bellwether. We had to respond to that. Where was research in this? We were not even a thought in the minds of administrators in terms of what to do to respond to research, because we're dealing with the scramble, not only of TU Rome, but then looking at a situation in which we were likely going to be sending all of our students, all 40,000 of them, home in a context in Philadelphia where, we have many partner institutions that also have significant numbers of undergraduate students. And so all eyes were sort of on what's happening, at our counterpart institutions with large undergraduate populations, both in Philadelphia. If you were to draw a 30-mile rim around Philadelphia, you would find another whole scale of institutions in New Jersey and in Delaware that were also affected. And so we're trying to move in tandem around that very, very big issue of dealing with the student needs, and then, of course, the family needs related to that. So you wouldn't imagine that when our notices went out that the Office of Research's website and emails would be trafficked by every family seeking an answer to simple questions like, are we going home? Do we get to stay in the dorms? Do I get reimbursed for my meal plans and so forth? But I think at one point, not only I, but every officer in our institution was just responding in real time to just the wave of questions that were coming in, understandably so. So what it meant for research is that we sort of didn't get to be the primary consideration in what was happening. We were sort of told, and with no differentiation to us or any other institution in Philadelphia or the state for that matter, this is your day, you're going home on this day. And at one point we were planning for 2 weeks from first week of March, and then it just got rapidly, brought forward as a more urgent concern. And so in the end, we thought we were planning for maybe a week from the day that we actually did go home. We went home a week sooner than we kind of thought we were going to. So you could imagine that led to an incredible amount of angst on the part of our research community. And we kind of built our way back from that you'll now work from home set of requirements to, I think, what is a more balanced approach on the return to work. I will say that the return to work, which we're already involved in fact, yesterday was our first day where we were bringing some of our high priority phase 1 researchers back. So we call that expanded essential research. So it means that somebody can come back if they have a new urgent need to come back. And we are looking at that as we speak to see how that return is going. But the return is much more complicated in many ways than the stay-at-home work order, because the return isn't going to be a return to normal. The return is going to be a return to a dramatically changed ability to have investigators in their spaces and a very different landscape in terms of what the priorities are going to be. So that's a little flavor of what I think is challenging for many institutions. I would imagine Caltech has a very different story. There's a different number of students and a different relationship between, the educational mission and research than there would be at a large state university where you have a very significant undergraduate student population. I'd be curious as the Caltech story.
Well, the story is much less complicated than what you were just describing, because between graduate students and undergraduate students, we're talking about slightly over 2,000 and 300 faculty. And ironically, we're one of the largest employers in the city of Pasadena, but it's a very small place. And we certainly experienced many of the same problems that you were talking about, but on a much smaller scale. And that, I think, made it a little bit easier to keep track of all the moving parts, but it was a struggle. I certainly don't want to underestimate that. Any other thoughts on this topic? If not, I'd like to move on to our next major topic, which is federal sponsors. And Craig, have you how have you found the response of the federal grant-making agencies to the difficulties that you've had to face at Michigan? What kinds of things have the federal granting agencies done that have been particularly helpful for you and your fellow administrators and researchers?
It's a good question, Dick. Thanks. And if any of our federal partners are watching, I want to thank you. Our federal partners get, I think, really high marks when it comes to how they have handled the COVID-19 situation and how they have helped guide us through these unprecedented times. In addition to our federal partners, I think we need to recognize OMB and the flexibilities memo, the M20-17, and also the subsequent memo on contracts 20-18, where the federal agencies were given an opportunity to embrace some additional flexibilities that would make the grantees' administration of their awards much easier. And I think everyone knows that that has been a tremendously helpful development. So thank you to OMB, and thank you to all of the agencies who have in varying degrees adopted those flexibilities. And I think, you know, leading the pack has got to be the National Institutes of Health. Michelle Bowles, Mike Lauer, they have really been on top of their game in terms of clear and effective communication to the grantee community, so that we are have clear expectations, and they're very responsive to providing additional guidance when the original guidance may not have been as clear as we would like. So, you know, Mike Lauer, if you've seen his YouTube talks, you know, 5-minute snippets here and there, really helpful. The FAQs that NIH has put up, very helpful. So going back to the issue of the importance of good communication when it comes to an emergency like this, I think NIH is leading the pack. NSF also, they recently delayed their implementation of the requirement to use Science CV or a form fillable PDF for the biosketches and current and pending support. That was extremely helpful. Now is not the time for us to try to tack on additional proposal submission requirements when we're so busily focused on other work. So all in all, I would say that we have no reason to complain. In fact, we have a lot to be thankful for when it comes to the work that our federal granting agencies have done on our behalf.
Well, thanks, Craig. Who else would like to comment on this?
Let me make a quick comment to thank the program officers as well. As a researcher, that's usually the first person I kind of call or contact, is the actual program officer who is in charge of the particular project that I'm working on. And they were really good early on at kind of reassuring us that things were in the works. This is before the FAQs were published and before the policy guidelines were you know, officially released. And also generally helpful about pointing us in the direction of new FOAs related to COVID-19 that were coming out that might be an additional source of income for us, particularly if you're on a no cost extension. That might be a way to continue to buttress an ongoing research project. So it's not just the people at the top, but I would say all the people that, you know, the PIs typically contact have been generally very helpful. Same was true, I'll give a shout out to Neidler as well. We had a switchover of a program officer, and she's also very understanding about the fact that our project is not going to launch anywhere near as soon as we had hoped. Again, it involves older adults, but older adults with a variety of cognitive impairments in this case. So very, very risky population.
Great.
Yeah, I was just going to mention that the OMB flexibilities memo is slated to expire on June 17th or 19th. I can't remember the exact date, but someone who watched the webinar yesterday may have something to share. I couldn't attend it, but it's important, I think, for planning purposes to know what the conversation is about the potential for extension.
Craig, I was on there. I just want to try, build on what you said. I completely agree. I think working with our federal agency reps has been a really good experience. I feel as though we've worked together as a team. They hear when we're having struggles or we don't understand how we're going to move forward. I think you said early on, some things we can't build on prior experience because it's new, right? So I've really felt like we've done that teamwork, and I think it came across even more than ever, but always from Michelle yesterday, who did indicate that OMB is considering an extension and that NIH does support such extensions. So it's just another example of how we've really worked as a team, both the universities, the research community. I get the feeling that they are just as concerned as every university about how to maintain the research infrastructure, that's critical. When I talked about ramping down research, that meant on campus. We've done everything we could, doing telework, working remotely, in order to preserve that infrastructure. And I think we have a shared interest with them on that.
And I agree with everything that the rest of the panel has said. And I also want to comment on how appreciative we are of individuals to participate in activities like our plenary here at FDP. There's an APLU bridge call with all the VPs for research once a week, and many federal officials have made themselves available in that forum to do a Q&A. And I know there are many other examples of this kind of outreach going on. There's conferences to come and meetings to come with Cura and COGR, and I expect the same kind of availability on the part of our federal partners. If we didn't have that, I think it would be very, very challenging to move forward with the kinds of decisions that we have to make without real concerns about what the impacts of our decisions would be. Like Johns Hopkins, we have the same. We have people working from home with continuity plans. It's nice to know that that's an acceptable approach, and all of the outreach has kind of helped us to understand that we're on sure footing. And by having that very clear set of messaging coming from our federal partners about the intent of the rules that they're putting in place, that allows us to go back to the rest of our leadership, whether it's our CFO or whether it's our provosts or whether it's our presidents, so that they understand when we charge a grant and we're charging for a continuation of research, they don't have to worry that over here we're going to face a financial issue in terms of an audit finding or other negative outcome as a result of that decision. It's been extremely helpful.
I would just add that, the image that many people have of federal agencies, including research agencies, is these gigantic monolithic organizations filled with thousands of bureaucrats who don't really care all that much about what they're doing. They just keep pushing the paper. That is absolutely nothing like what we've experienced, especially during these last weeks, where we really couldn't ask for much more in terms of understanding and in terms of coming up with creative ways of dealing with the issues that we've been faced with. So our federal partners have truly stepped up to the plate. Alex, I think it's well understood that with virtually every single federal award, there's a requirement that the people carrying out the project notify the sponsor when there are unanticipated delays that may impact the progress of the project. How has your institution handled the notification of sponsors? Does this have to be done on an award by award basis, or is there a way that this can be handled centrally at the institutional level?
Well, I think universities have gone on both paths. And particularly at JHU, early on when we knew we were going to have to ramp down in-person human subjects research, we sent a blanket letter because we didn't know the impact yet. And we just sent it to OHRP and to Dr. Lauer, just saying, we're ramping down. We want, this is serving as our notice. We'll get back in touch with you when we know better, project by project. And that seemed to be satisfactory at that stage during that, early on crisis stage. In general, though, I can't necessarily answer that definitively because each project has its own considerations. You have different funding mechanisms. You're dealing with a grant versus a contract, the nature of the work. Like I said, a lot of our work could continue remotely. So I really have seen, as a research administrator, it's been a team effort, working with our faculty, making sure, as Neil suggested, working with the program officers, discussing what their struggles are, and having the administrators help navigate what the agency requirements and to ensure compliance. So I think, that's really my only, a contract, you're going to have to work directly with them, and I think they've been pretty effective.
Who else would like to comment on that? We heard one interesting thing from Michelle Bowles, and I think it's something that's also on the NIH COVID-19 website, and that is that wherever possible, investigators should use the annual progress report to describe the impact of COVID-19 on their project. That's sort of the preferred method by which they would like to hear about it, unless there are some incredibly catastrophic, unusual circumstances, in which case it might be appropriate to have a separate notification. But in general, the progress report, and I think this would be true not just for NIH, the other agencies as well, that's the preferred vehicle for conveying this information. So,
no, thanks, Dick. I knew I was forgetting something, but it would be nice. I think it was excellent that NIH recognized that this is, probably a good way to avoid being inundated with paper and notices. And it would be excellent if other agencies could clarify that's a good option.
Yeah, I heard about one university that I won't mention that was thinking about mass producing thousands of letters to be sent for each active award they had on file, saying things like, well, there's this COVID-19 situation and it's impacting our research. Yours for a better tomorrow. I don't think they actually did that, but it was a
No, I think they did.
Oh, they did.
I thought they did send it. Yeah, and then we got the
Okay, so let's move on to some financial issues. And Michelle, is your institution paying faculty and staff from federal grant funds, even if they're not able to work remotely because of COVID-19?
Yes, we worked very hard with our business managers and leadership of the institution to educate them on the allowance that was provided to us by our federal partners so that they could get comfortable with the idea that we would continue to charge the grants. Not to say that they wouldn't have wanted to see our employees continue to receive funding, but everyone wanted to be sure that we weren't going to run into another compliance issue of effort if we were continuing to pay people from their grants. So what we did in order to ensure that we had some backup for the decision that might anticipate any additional instruction that we would receive either from specific program managers or in subsequent guidances, because as we know, there have been sort of a moving target of criteria in some cases on some of the legislation that's come forward. We asked every investigator to develop a research continuity plan that would explicitly state how they would be doing research in a work from home environment, or alternatively to identify their urgent and persistent need to be able to utilize campus and under what circumstances and for what amount of time. So we did that, and I think that's a pretty common strategy that was used by many research universities. We did that, and then we kind of gave a leeway for those investigators that had more pressing needs. For instance, those who are working with animal populations, or those who are working with a certain set of bioagents that needed to be maintained or checked on, any kind of special facilities or equipment that needed to be routinely examined. We made provisions for the ability to do all of that, so that I guess I would say the bare minimum of kind of apparatus, you know, could be maintained, so that we wouldn't be facing a return down the road in which we had lost all of the investment and all of the continuity in a forward-looking way. So sorting that out has meant a lot of communication with deans, associate deans, and specific faculty, so that we could make sure that we had a plan that was flexible enough to accommodate those needs, but insisted on preserving the most important element of the stay-at-home order, which was to maintain safety for our faculty, who we obviously want to be able to return and continue to, you know, be successful and productive for years to come. So it's a quick answer is yes, but behind that yes was an awful lot of work done to make sure that we had some backup documentation to justify the choices that we made.
Yes. Anyone else like to comment on this? There's a related question, Alex, that has Johns Hopkins established an end date for paying faculty or staff unable to work on their sponsored projects because of COVID-19? And if not, how do you think that might occur?
Well, first, I think it would be nice if we know what whether the OMB guidance is going to be extended. And in the meantime, we're using all flexibilities that are afforded under that guidance and maximizing telework. So I think we're essentially not closed, but we're working remotely and using the flexibilities in, you know, where needed.
So I'd like to pass along a comment made by one of the attendees at our session today, and that is, if you are interested in contacting OMB about any of their existing memos or encouraging them to extend the current flexibilities, you can send an email to grants team, that's one word, grants team @omb.eop.gov. And I'm sure that they will be interested in hearing from us, as they are interested in hearing from the individual federal agencies. So Craig, what about summer session? What are you going to do, or do you know what you're going to do about handling faculty summer salaries this year?
Yeah, we did make a decision, and the important thing to know about Michigan, like many other institutions, though, is that we have more than two types of faculty, but two main types. That we have 12-month and what we call university year, U-year, which is 9-month or 8-month appointments. So we're treating them a little differently. The upshot of our policy is that if you are a 12-month faculty member and it's a continuation, the summer appointment is a continuation of an existing appointment, then you may continue to charge effort to the project even if you can't work on it, because it's a continuation of a prior appointment. And this presumes that it's on an award that was active at the time that the OMB memo was issued.
Thanks.
So we feel like we're pretty safe ground given the OMB memo when it comes to our 12-month faculty. For our U-year, our 9-month faculty, what we have decided is that because it's not a continuous appointment, there's a break in the appointment, that in order in order for effort to be allowable on a summer appointment, they have to be able to work on the project. So we're not extending the same flexibility for effort where there isn't an according benefit to the grant the way we would with 12-month appointments. And I'm anticipating a little bit of pushback just because NIH recently clarified on their FAQ that summer effort was okay. But if you go back and recall the language around the OMB memo, it says that in order for you to do this, you have to have a policy that applies irrespective of source of funds. And we don't have any assurance from other federal agencies or the inclination to allow it for internal funds to say that we're comfortable with that, with a 9-month appointment during the summer if no effort is benefiting the project. Was that clear, or
it's at times like this that I am deeply relieved that Caltech has no 9-month appointments for faculty. Our colleague Kim Moreland has posed a question that I'd like to pass on to you. And she says, we're often asked these days to estimate the cost of research delays and research rebooting. How are your institutions going about estimating the costs to research as a result of COVID-19? We are looking for a model, aren't we all?
Yeah.
So who would like to tackle that one?
Our University Administration Budget Office developed a template that has gone out to the entire university down to the department level, asking them to track it, and they're submitting, they're due once a week, and then they're rolling it up and using that for projections of losses, and also tracking, I guess, if down the road there's insurance or FEMA funds available. So we are tracking it at the highest level, but down to the department.
Who else?
I've been asked to do a number of projections over the last couple of months on the cost of COVID-19 to the research enterprise. And there are so many unknowns and variables that it's probably, to say it's a best guess is being generous. One of our concerns that we have that we don't know whether or not it's going to really materialize is the extent to which our industry-sponsored research is going to dry up as the economic conditions deteriorate, if they do. And there's a little bit of a internal debate on whether or not we're going to lose half of it, or are we going to lose a tenth of it, and how smart are we going to be in response to the costs that we're going to have to throttle back on. So if you take into account projections on what percentage of your workforce is actually going to be in quarantine or unable to work, how reliable is the source of revenue, these are the kinds of questions that nobody knows the answers to, but they're baked into a model. Gives at least a low impact and a high impact range of estimates that seems to be good enough for directionally correct.
I think you
So
raised
Dick was,
a good point, Craig, which is that there's one set of costs, which are the actual costs of the ramp down, the administrative implementation, helping people be equipped with equipment that allows them to work from home, all of those adjustments, the inefficiencies, the slowdown in being able to meet the outcomes of a particular project, a delay in the submission of a grant. But then there's an opportunity cost component, which is what's the shift that's happening underneath all of that to the substance of your research operation based on the available or shrinking resources that exist, more globally. And I don't think we know yet. That would be my answer for Temple. We're certainly tracking the immediate costs. Much like Johns Hopkins, our CFO put out a template. We all update that, and we've adopted something fairly similar to that for our research business administrators at each of the schools and colleges to share with our office what their costs are for research so that we can begin to estimate them and compare those against what's bundled up to the CFO's office. But in terms of the opportunity costs in different areas of research, that's something that we'll be watching as I have a little dashboard that I watch all the grants that come in and all the expenditures. And so every week when I look at that dashboard, I have a little mini heart attack before the next wave of input comes. And I try to think about what does it mean that our awards are up, but our submissions are down by almost half. So it's like, is it that we just have now we're now COVID-19 research university, or, so I think we're all sort of figuring out, those kinds of dynamics.
That's a really good point, Michelle. I agree that opportunity costs, I'm not sure. We're tracking costs, the obvious things that you can track. Otherwise, we're just looking at trends. So we're doing weekly running numbers and looking at proposals for the exact same month last year versus this year, and watching trends.
We're doing the same at FSU, I believe, although I'm not privy to those immediate discussions. But yeah, I was told that despite my personal impression that a lot of people are pretty distracted at this point in time and or overworked, that our submission levels are holding constant. I think it's probably too soon to tell.
Well, my compliments to the panel. Kim Moreland has said, good answer. We're tracking a range of potential losses to awards, and that's certainly reasonable to include in the numbers. How you go about that, of course, is really the question. And all of this discussion has reminded me that when I applied for my current position almost 25 years ago, I missed something in the job description, which was the ability to predict the future. If I had noticed that, I might have withdrawn my application because my abilities along those lines are rather limited. What I'd like to do now is move ahead and address the issue of the role of the FDP. I mean, after all, this is a part of the Federal Demonstration Partnership. So, Alex, based on what we've learned thus far, what do you think the role of the FDP might be in responding to the challenges posed by COVID-19, and any thoughts about how we could work with our federal partners to pilot or demonstrate some administrative practices that could improve the efficiency and effectiveness of managing federal research projects? Again, please predict the future.
It's no sound.
Alex,
I muted myself just in time to have to speak, right? I think FDP has always played a huge role in reducing administrative burden, both for administrators and then later in some later phases on faculty. I think obviously based on our discussions, and I think we're probably representative from across the country, that the burden, the pace, the complexity, and the burden are all significant from this COVID crisis. And I think FDP certainly does have a role to play when it comes to looking at what our needs are and where are the areas of burden. To me, when I think about this, I think about the OMB memo and the flexibilities that were granted to agencies in order to flow to universities. And those flexibilities were necessary because we were in a time of crisis, and it was recognized that the pace of need for getting grants out or for continuing our research in a different environment might require flexibilities outside of what we're usually granted. But when I started thinking about it, I thought, could this in fact probably the largest demonstration we've ever seen of the OMB telling federal agencies, relax some of these prior approvals and offer some flexibility that allows us to continue our work without the burden that's normally required in some of the prior approvals. So maybe it's something that we want to look at, hopefully when things calm down, is what are those things that really helped us, reduced our burden, and that in going back in retrospect really didn't have a negative impact on our compliance. So I would really like to maybe have a group look at that and study what are the things that we work together on the agencies, and we're able to format it and frame it around a way that we're still in compliance, we're still going to get through audits, but that we were able to work at a lightning speed compared to how it normally is.
That's a really terrific response, Alex. Who would like to add to that? Well, I'll add something. I kept thinking as you were speaking that necessity is the mother of invention. And hopefully as a result of the necessities we've been living with, we can, as you suggest, come up with some ideas that could become more permanent rather than just of an emergency nature. So I'd like to, anyone else want to? Okay, I'd like to move on to another topic, which is, and Neil, I'm going to ask you to comment on this. So we've talked a lot about COVID-19, that's in the title of our session, but are there other major research administration issues or topics that are being ignored or deferred or delayed because of all of our focus on COVID-19?
Unmute.
Oh, Neil, you're muted.
Sorry about that. Yeah, that's a very good question. I think it probably depends a lot on the university that you're talking about. So at very high research activity universities, such as Florida State, we have a fairly resilient research infrastructure, in part honed by years of responding to hurricanes that we get in our state. So, and the other thing I guess I'd point out is we're really fortunate to be living at a time when our ICT tools, information communication tools, are so powerful. I hate to date myself, but when I was in grad school, we used punch card decks and IBM mainframes after midnight as a grad student to get work done. So I think, yeah, there's probably a fair amount of things that are currently on hold now, but I noticed, we're about to push out a new research administration program, RAMP. That's going ahead. The training for that is being done remotely. But I'd say anything, because we have, for instance, we've got a hiring freeze going on right now. Anything that involves new initiatives, which involve adding personnel, although there are exceptions, it's very difficult to do that. And the other thing I'd say is, I'm noticing kind of informally, is that people are having difficulty focusing on things like new grant opportunities. I keep, just give a personal example. For my institute, I keep having to reschedule a group that's working on an FOA. Why? The lead for that particular FOA would be a physician. He's way too busy with clinical practice demands at his, particularly now that his clinic just reopened. But I've been told our submissions from the university are up, if anything, at this point in time. But I'd say, yeah, it's definitely having an impact on new initiatives and anything where the sort of tightening of resources that's taking place right now can affect. So people are, from the top level to the bottom level, people are being really cautious about initiating anything new.
Anyone else want to add to that?
I noticed in the Q&A that there was a question about whether or not we're experiencing other kinds of differentials, such as early investigators or women with children facing issues around work-life balance, satisfaction issues that might impact their ability to connect. There's some evidence to suggest that there are very differential effects. And so as an issue, we're always concerned about equity, we're concerned about participation. And because I think that's a kind of issue that because we're working ourselves from a work from home and remote situation, it's really difficult to grab a handle on how deep those impacts are and how long lasting they may be. If you're not already aware of it, APLU, the Association for Public and Land Grant Universities, maintains a list of the tenure approaches that are being dealt with by institution. So that's one small strategy that's been put in place. And of course, we all understand there are pros and cons to changing the tenure clock for individuals, but nonetheless, I think most institutions are finding that they may have to be flexible about that kind of thing. We also have a very big research incentive program that we keep kicking back the launch of, and that's a little awkward how I said that, but anyways, we keep postponing the launch of this program because we have to deal with the urgent needs of COVID-19. And everyone in our research system is completely bogged down with dealing with that capacity. Well, that's, you know, one small part of our research enterprise is going to be benefiting from and contributing to that knowledge base. But all the other areas of research, which don't really connect with COVID-19, I think are maybe not getting the same level of attention at this time. And I think that's concerning for us because we need to have a diverse research enterprise, not just, you know, sort of one area of research that's leading. And so we think about that, but we don't even have time to act on it. We're just in go time all the time.
So Michelle, one of our participants today commented in response to something you said earlier that our grad students also have children, and childcare opening and reduced capacity is going to have a significant impact on them as well.
I couldn't agree more. And guess what? So do our staff. You know, we have a stay-at-home for children in the school district. You know, there's no childcare available. We have every personnel rung you can imagine is, you know, sandwiched between dealing with their family responsibilities and the requirements to continue to work. And like Craig, we're all incredibly grateful to have jobs and to be a part of an industry that's a knowledge-oriented industry in which we can continue to be really meaningfully contributing to the knowledge economy, even from a remote standpoint. I think the lessons to be learned will be told for years to come, but we also have a very unequal underpinning to all of that. And so different individuals are facing challenges in different ways. We've done what we could to make sure that we provide equipment, for instance, to people who don't have what they need at home to be able to effectively work from home. But, you know, even individuals that are, you know, well compensated and have lots of resources are finding that as, you know, two parents are on, you know, the internet and kids are homeschooling and, you know, you're trying to find private spaces for everybody, you know, in the household to do the work that they need to do in their respective lanes and monitoring the different ages that people may be dealing with. And not for nothing, we have a significant number of staff and colleagues who have family members who have either passed away from COVID-19 or who are affected by COVID-19. So there's also a really big psychological toll that's being shouldered by our staff that I think we can't ever lose sight of the fact that that's a big part of what's going on as well.
Any other comments?
Dick, I'll just add, in terms of other research administration topics that are being deferred or delayed, one in direct response to the budgetary pressures that we're seeing is that our research administration training program for campus is on life support as we think about next steps. So there are real consequences for the institution because of the pandemic. And the other thing that comes to mind is that it wasn't that long ago that every one of us was concerned about and consumed by undue foreign influence. And I almost look back nostalgically on those salad days when that was the biggest concern we had. Well, I don't think we're going to be able to enjoy that lull much longer. It's not that we stopped paying attention to it, but we just knew that we had to put out other front burner fires before we got to that. So as a matter of fact, in about 40 minutes, I will be having a conversation with the Government Accountability Office to share some of our best practices.
Please give them our best wishes.
I certainly will.
I was going to say that I'm glad you mentioned I call it foreign entanglements. That's probably not the right name for it, but that was a topic that was consuming the meetings of this organization and other organizations for the last 2 years at least. And it's not going away. I don't believe that for a minute, but it certainly has stepped back, at least for a brief time. So I'd like now to turn to the conclusion of our session today. And I'd like to ask each of you to say something about the lessons learned, if any, thus far, and how these lessons might influence your actions as we enter the next phase of COVID-19. After all, we're all involved in universities. We're supposed to be focused on teaching and learning. So what have we learned?
Well, my boss says never let a good crisis go to waste. She's actually an amazing leader and an emergency medicine doc, and so she knows how to handle a problem. And so she's been a real study in leadership for me to learn from. I hope she isn't hearing this, so that she'll think I'm trying to get a promotion. But she's really been an example to the whole campus community about effective communication, the importance of controlling the message, being clear and open about acknowledging the concerns that colleagues, faculty, staff, students all have, being empathetic in response, but also firm about what the institution needs, making sure you assemble the right team, regardless of where that team member sits on the org chart. And it's okay to push people in a crisis because they will step up to the challenge. You can't push them forever, but asking people to do more than the ordinary in extraordinary times is not unreasonable. So I look at what she has done for the institution, and I think, okay, that's instructive for me in my role to emulate some of that behavior as well. And another interesting, I think, approach is the appeal to our faculty to help them understand, yes, we know that they all want to get back into the labs immediately, but we are also under the microscope for the university to demonstrate that the fall semester is possible, and so we have to do it well. And if we mess this up, the impacts will be nearly devastating for the entire local economy. So helping people understand, while the research is important, the health and safety of our people is more so, and that there's a lot riding on it more than a publication.
Thank you, Craig. Who else would like to comment on the lessons learned?
Maybe I'll just jump in. One of the things I guess I've learned to appreciate is that we have a relatively flat hierarchy in our chain of command at FSU. So it's not hard to get up to high levels if you're a faculty member, or to be interacting with faculty if you're up at a high level. And I'd argue that having that type of a chain of command has allowed so far for free flow of ideas and problem solving, both kind of at the bottom up level and also kind of top down, so that we have much better planning and decision processes. The other thing that just was underlined for me so far by this crisis is how many highly skilled people are employed at universities. I'm talking about the staff, the faculty, the students. They've been absolutely great in these very extraordinary times, and proves yet again, certainly in a knowledge industry like the university, that people are going to continue to be our greatest resource for meeting these types of challenges. just kind of on a micro scale level, though, something that really has been brought home to me as a researcher is I'm going to have to be thinking a whole lot more about how I can design experimental studies to be portable to things like home environments, so that data gathering can continue to be a resilient process. So those are at least a few lessons that I've kind of picked up.
Thank you, Neil. Michelle or Alex?
Sure. Well, it was put to me by one of my colleagues not long ago that we were on a 10-year plan to have distance learning and remote work, 10 years, to do the proper planning and to think about all the contingencies and ensure that we did that in a fair and equitable manner. And we did what was our 10-year plan in a 2-week period of time, like every other university in the US. So I guess what I take away from that is that, you know, people will not disappoint you if you give them an opportunity to perform. My own team has been incredible. I couldn't even begin to say how impressed I am by the work that they have done to take every single research operation and take it online and be on time or even ahead of what our performance metrics are typically. That's being done because everyone is taking this situation at urgent. And so no one is really letting anything go out of a concern that we not cause a ripple effect in our very, very dispersed system right now. And I think that speaks to another characteristic of higher education, which is that many of us in our institutional settings need to recognize just how dedicated everyone is to the mission of providing a high quality education and contributing to, you know, the performance of research. And I think, you know, we often think about that as in the hands of our investigators, which it most certainly is. But there's a small army of people that are cheering them on all the way. And right now in this situation are doing as much as they possibly can to help make sure that we keep going. Because if there's one thing we've learned about this crisis as a whole, it is that research is going to be the solution to the problem over time. You know, we're not getting out of COVID-19 without the discovery and the innovation that's going to come from the nation's research community. And so I think everyone, even if they're not maybe explicitly saying that, it's clearly understood in our community.
Yes, I definitely agree. Alex?
So I agree with everything everybody said. I think I wouldn't call it lessons learned, but I have been impressed with the increased collaboration. My staff, my coworkers have been amazing, and they continue to be. I would say a lesson that I've always known, communication's always been the challenge, no matter how good at it you are, right? I think we've learned better ways of communicating. You didn't see me, but I'm always fumbling, so I'm getting much better with technology. So I'd say that some lesson learned is like how to work better with technology. And then I think understanding, one of the things that I've thought about is we can't be in crisis mode forever. People are going to burn out. And how do you start thinking strategically about the future? And when I look back at how well our office and the university in general did with ramping down and moving to a remote environment, it was because there was a lot of planning, yearly planning of crisis management, business continuity. And so when I started talking to my coworkers and saying, I think we're going to have to start preparing now, and some of them looked like they thought I was crazy, but we were ready. By the time that it was time to do it within a 2-week period, we had some technical glitches, but I think the lesson learned is that you can't plan too much. And even if you don't know what you're planning for, just knowing that you're ready to, especially when you have an amazing staff and bunch of coworkers, knowing that you'll have the resources to help transition them and support them. And now we're working on how to not have them burn out and working on morale. So.
Well, thank you, Alex. I'd like to thank all of you, Michelle Masucci, Alex Albanak, Craig Reynolds, and Neil Charnas, for a very engaging and helpful discussion about issues related to COVID-19 and the impact from the university perspective. Obviously, we didn't cover every single conceivable topic, but we did get through most of the list that we had developed. And I want to thank you very much for your participation. So we are only 1 minute over, which is nothing short of miraculous.
Pretty amazing.
And
Thank you,
I'd also
Dick.
like to thank the people behind the scenes, Alex Velasquez, David Wright, and Denise Moody, for making this a very flawless and enjoyable activity. So this session concludes the virtual May meeting of the Federal Demonstration Partnership. After the session is over, the recording will be posted on the FDP website. All of the sessions that have been taking place over the past week will have their slides and recordings posted to the website. Thank you all for participating, and we wish everyone a safe and healthy summer. Thanks and good afternoon.
Thank you.
Bye-bye.
Bye.